there's a prescription and the directions, or just the prescription, let's not even say the directions, and it's unclear. What does a pharmacist do? Well, I'll tell you what this pharmacist does. I'm going to call the provider. Situation where there was an order for a microbid, which is an antibiotic order for a patient who had a UTI. And the dose of the antibiotic was 500 milligrams 4 times a day. The dose was clinically appropriate. You can treat a UTI 500 milligrams 4 times a day, but it's not typically dosed that way. Most times you're going to get 500 milligrams twice a day. I just reached out to the provider and I said, hey, I know you can give this medication this way, but I wanted to make sure that this order was correct because you just don't commonly see it that way. Most times, 9 out of 10 times, providers are going to be really nice about it. They're going to thank you. In this case, it was incorrect. The provider just made a mistake. And so we changed it and we got it verified. That is what I would do. I've also had a situation where what I thought was completely not the case. So I had a prescription that was sent in for a male patient. It was for Depo-Provera, which is given for contraception in females, and the diagnosis code on it said hot flashes. Now, my specialty is not hormone replacement therapy. I do see little bits and pieces here. So I know that sometimes when a female patient is going through menopause or perimenopause, the provider will give small doses of testosterone to kind of help out. So hormone therapy is its own thing. And again, it's not my specialty. I just wanted to make sure that I covered my bases. And so I gave that provider a call and I said, hey, listen, I got this prescription for this patient. I just wanted to make sure that this is what we were doing. And they said yes. Now, some pharmacists are really adamant about flexing their pharmacist muscle and telling the providers, well, you can't do this and you can't do that. I'm not one of those pharmacists. I like to have a collaborative environment, with all the people that I come in contact with, not just people that I work with. But people that I work adjacent to. So we may not necessarily work in the same building, but if we have to work together as healthcare professionals for a patient, I really want to keep those lines of communication open because I feel like me being able to communicate with other healthcare professionals about a patient's health is going to ensure that that patient gets the best health outcomes. However, I also don't shy away from some situations where I feel like morally or ethically, if I had to defend my license, I just couldn't. It would not make sense. So recently I had a prescription where, from what I could tell, this patient was a relative opioid naive patient. They hadn't been on opioids for long enough, at the dose enough to be considered experienced. Hydromorphone, 4 milligrams, 2 tablets every 4 hours, and it was for like a 10-day supply. And so I called the provider. I don't speak to the provider. I speak to the provider's representative because the provider was unavailable. And the representative basically tells me, well, that was the patient's pain management doctor, so we don't know anything about that. We're just providing this because the patient needs it. I mean, this person that I'm talking to is just completely like not coherent with things. Like nothing that they're saying is making sense clinically. And so I ended up calling back. I asked my colleagues like, hey, what do you guys think about this? So ultimately we called the doctor's office back and we told them like, hey, we're not going to be able to fill this for the patient. Would you like us to give them a call to let them know? And the office decided that they would give the patient a call and to deactivate the prescription. So I think sometimes patients and the general public, they kind of get caught up on the prescription for it. I need it. It doesn't matter what the insurance says, and it doesn't matter what the pharmacist says. And that's just not how things go. I think we just naively have this approach to prescriptions. And that's not how it works. And pharmacists have what we call the corresponding responsibilities. And in my experience, and not personal experience, but just listening and hearing of other situations that have happened with other pharmacists, pharmacists are almost 10 times more likely to get fined or penalized if they do something morally or ethically or clinically what a governing body would deem as inappropriate. And so, like I said, we have a corresponding responsibility, which means that we have to ensure that what we are feeling for makes sense in all of the different areas. And I'm not one of those pharmacists who tries to flex the muscle, but my philosophy is, if this goes to court, if I have to stand in front of a group of pharmacists to defend my license, can I do it and walk away feeling confident that I did what was in the best interest for the patient, for my license, for my company, all of the things? And that's some advice that I would actually pass on to future pharmacists or other healthcare professionals. If you have a decision that you need to make and your rationale would not pass for 8 out of 10 people, you probably shouldn't do it. Don't do it. So yeah, that was a question that I received actually, was how does a pharmacist handle unclear or incorrect prescriptions from providers? I hope that gave you a good synopsis. And as always, until next time, bye.